Only one testicle. Really large.
What is it actually, Phil?
So it looks like a mass. I hope it's not a hernia. It's come in with a large mass, so we're going to surgically explore it.
Is it an older bird?
This is a bird over 30 years old, so it's super old. Before we did surgery, we've done a blood screen to just check its cholesterol and various things, and its bloods were really good. It was very slightly anemic. I think it's been bleeding from here as well. You can see some ulcerative areas. But it's quite a large mass, and if it's a hernia, I wonder what's in the hernia.
There were issues with the wings too, weren't there?
I've just got onto the case as the surgeon. I haven't really looked at the wings yet.
So I think they said they were missing flight feathers. It's not been looking after itself as well in its old age.
Being the surgeon, I've really just evaluated the lab results, seeing that the anaesthetic is safe. So when we get older birds like this that are 30, a little bit weak, we don't anesthetize them the same way. We actually start them very light. In fact, we start them on pure oxygen. So this bird gets started on pure oxygen, and we've started slowly turning up the drug we use. The anesthetic is isoflurane. And he's had a little bit of pre-med, but he's now on 1.5% isoflurane. And that's what we do with our real old birds to try and get a really good outcome. And we start removing the feathers while they're going under. So he hasn't been fully anesthetized yet.
That will have been there for quite a while, won't it, Phil?
I think so. I hope it's not a hernia, because if it's a hernia and pushing organs back, it becomes quite an issue. Anyway, what I might do is we might have to go a little bit deeper now. So now once the bird's starting to go down, although it's still on a very light. This, if anyone's watching, this is in Melbourne. It's although it's an October day, it's actually pretty cold. It's pretty cold today. So we've got multiple heat sources for this bird. We really don't want it to lose ambient temperature.
Do you want to go up to 2 now, Phil?
No. What are the eyes like?
They're slitty, but he's blinking. He's still awake.
But so we can go up, but we're going down slowly. We've started 0 to half, 1, 1.5, and he's going down very slowly. And in your older birds, for vets who are watching, we've just found it so much better in our older birds to start them a little bit lighter. What I'm saying is standard literature understanding. You know, if you're the safest anesthetic, you're gonna.
What are you doing now?
So I'm giving subcutaneous fluid, sterile Hartmann's. We've injected about 12 mils in each side. Obviously, for those watching, you could have used a slightly bigger needle. It doesn't take so long to inject it.
You're in the inguinal area?
Yes, in the inguinal area.
Pronounce it better than I do.
Well, remember the pronunciation of words.
Depends on your accent.
So I'm gonna
Alright, move out of your way. So what's come out of that, Phil?
I don't know. Not sure what this is. But we'll look at it in a second. It's quite bloody. I want to just get rid of the mass. We're using radiosurgical hemostasis, so there's not too much bleeding. So it uses radio waves to cauterize, so there's no bleeding, and then it doesn't damage. It seems to not damage the tissues as much as regular cautery. So for bird surgery, the stuff is pretty good. So this is a mass that we've taken out. You can have a look at it. Is it a tumor or not? It goes into our... And you can see some of the tissue that came out of the mass.
Is that pretty typical?
No, it's not typical. Normally you just get fatty stuff, but this is pretty vascular and pretty solid, so we should actually probably put it into a histopod. So we'll discuss sending it off for the owner. Maybe she wants to send it off. We're now going to close it, so I'm going to just quickly evaluate the wound. Does it go into the abdominal cavity?
Is it a hernia?
No, it's not a hernia. It's just very close to the vent. So we're going to close it up. Here's the vent or the hole. It's very close to the vent. It's going to put a little bit of pressure with this. So we're going to try and close it, put as little pressure as possible on the vent. All right, can I please get some 4O Vicryl? 4O that. So if any of you are watching, the reason we use Vicryl in these birds, it's a really old suture material. It's multi-filament. It's got capillary action. You get bacterial buildup in it. So for all of you guys balking, you're right. It's not a good suture to use generally. But the skin is so friable, and at least it has a good purchase in the skin, or it holds in the skin quite well, and it's not going to. Hopefully, it won't dehisce the wound. That's the only reason I've chosen to.
So you use the word friable. To a normal person, that means something you can cook in a fry pan. That's obviously not what you mean.
So friable means it just like breaks easily. It's like just so it breaks easily. It's doesn't have any strength.
Then I've got Mandy on the phone. She's at Aldi. Is there anything you want?
Coffee. Is that a coffee for the coffee machine?
Coffee for the coffee machine? Yep.
Is that what she phoned for?
That's what she's phoned for.
She sounds so happy she phoned. Coffee.
Coffee. Okay.
How did she phone? She phoned from Aldi. Wow, that's a. I mean, I'm glad she phoned. That's a good thing to do, Carla. I don't know what to phone and said you need anything. That's a considerate, caring thing to do. I wasn't expecting that. Not that she's not caring. My wife is the most beautiful, caring person. In case you're wondering. Based on my mother and sister. My mother and sister love her more than I do. What do you think of that, Dakota?
No.
Do you think? Imagine if my mother thinks she's the best thing in the world, and my sister thinks she's the best person in the world. How's that for a family affair? And you're videoing us.
Mm-hmm.
If I haven't said anything bad about me. You can go down to 1.5, please.
Mm-hmm. How are you going there, Phil?
We're going really well. I'm trying to get closure. It's right by the bird's vent or backside. Where it passes. So I'm trying to get nice closure. I'm using an inverting pattern, which is a cross mattress that slightly inverts the edges, with the aim being to I'm very happy that cosmetically the vent is in place. I've used a little bit of a it's not but a little bit of a flap that we've kind of pulled over, but now once I've got this end part closed quite nicely, I can then worry about closing the rest of the wound. It's just got to be able to pass. It's so close to the vent or the backside. So we're finishing off. We're putting in the last stitch now. We've turned the anaesthetic down a bit. It's we've got a reasonably good closure. It's like you can see, it's a pretty big wound. We've taken the lump out completely. I'm happy that whatever it is completely out, with even a small margin, which is really good. So this is 5.0 PDS that I'm using to close at the moment. They're just some of the, now that I've kind of got the skin in line, but I had to leave, I took out all the unhealthy skin and I'm stitching healthy skin to healthy skin of sorts. And the final stitch in the procedure, I just don't want it to come out, but it looks absolutely beautiful. I mean, I'm very happy with the outcome. Beauty is in the eyes of the beholder. I think this looks really good.
Nice.